Welcome to my presentation. My name is Izzy, and today I will be talking about amyotrophic lateral sclerosis, also referred to as ALS. So, what is ALS? ALS is a progressive neurodegenerative motor neuron disease impacting the neurons in the brain and the spinal cord. There are two main types. The first is sporadic ALS, and this accounts for about 90% of cases. It's the most common as it occurs randomly without a known cause to why it occurs. And the second type is called familial ALS, and this accounts for 10% of cases. And this is caused by inherited mutations in specific genes. So this is caused from a known cause. So a little on the prevalence, ALS is more common in male older adults. It usually begins early as 40 up to 70 years old, with the average range being 55 years old. And the disease develops around 1.5 to 3 new cases per year for every 100,000 people in the American and European population. And approximately 30,000 people are affected in the United States, with an estimated 5,000 cases diagnosed each year. So, before going into more of the aspects of the disease, I'm first going to discuss the root cause of the issue, which begins at the motor neurons. So, a little on motor neurons, there are two types of motor neurons. There are upper motor neurons and lower motor neurons. So, the upper motor neurons send messages from the primary motor cortex in the brain to the spinal cord or the brainstem. And these lower motor neurons are going to receive the signals from the upper motor neurons to send the message to the muscles in our body, which helps us produce movement. So, as you can see on the picture, on the left, it's going to illustrate how these upper motor neurons begin in the primary motor cortex of the brain, going down to the spinal cord, where these lower motor neurons are going to transmit that signal towards the muscles. And ALS will kill both of these upper motor neurons and lower motor neurons. So, first, it's going to disrupt the voluntary movements by attacking neurons that tell our muscles to move. And these voluntary movements include things like walking or running. And secondly, it will attack involuntary muscle movements. And these involuntary muscle movements are things that are related to things that are not voluntary, so breathing or your heart beating. And now this leads us to our consequence. So the problem is that these motor neurons are dying, and when motor neurons die, they can't regenerate. So as the communication between the brain and the muscles fail, it's going to lead to progressive muscle weakness, paralysis, and even respiratory failure, as that's in an involuntary muscle movement. So now that you understand a little on the progression of the neuron deterioration, I'm going to discuss how ALS is going to impact speech. So dysarthria is one of the most known symptoms in ALS, as the disease kills motor neurons that control and are responsible for speech. So dysarthria is a motor speech disorder that's characterized by muscle weakness, and that's going to result in impaired speech. And due to this, ALS patients will eventually lose their ability to speak. Over 80% of ALS patients experience dysarthria, and these symptoms can include slow speech, slurred speech, poor articulation, so poor movement of those mouth muscles that are involved with talking, poor volume control, and even vocal changes like a breathy voice or even a hoarse voice. So a little bit about the SLP role for ALS patients. SLPs can predominantly focus on speech, and this can include providing counseling, doing assessments, treatment of speech, and treatment of voice. So a little bit about counseling. This is so important as these patients are going through such a difficult time, and they really need to adjust to learning about their condition. So SLPs can provide some education to patients, family, and caregivers, and also be an emotional support for them. They can also provide communication strategies throughout the disease progression, and also set those realistic expectations. So, a little bit on assessments. The SLP can provide an oral mechanism exam to look at the structures in the mouth. And this is really going to see how much of the speech is impaired for the ALS client. Um, they can also give a voice handicap index, which assesses the impact on voice problems on a person's quality of life. So we could really assess how that voice implication is impacting the patient's life. And we can provide a dysarthria assessment, which is going to assess that speech function. So treatment of speech, SLPs can help them with breath support during speaking. Um, they can provide portable suction machines, which just suctions the excess saliva just to create a more clear speech. They can help them with slowing down their words and exaggerating articulations, usually at the end of the sentences, which is going to help them provide and produce a more clear sound. And then expiratory muscle strength training was noted to be associated with improved speech outcomes for ALS, which just strengthens the breathing mechanism for speech. And then you have treatment of voice, and treatment of voice can include a voice amplification system that just helps overcome a reduced vocal volume. So having those patients really bring their volume up for more clear speech. So the SLP is also responsible for helping these patients in both message and voice banking. And these are two communication strategies that are used to preserve a person's voice or messages for future use. So this is super important as these ALS patients will eventually lose their ability to speak. So message banking is used when an individual records phrases in their natural voice to be played on a communication device. And voice banking is used to create a computerized synthetic voice based on the client's speech samples that they recorded. And these phrases can include, I need to go to the bathroom, I need some help, hello, how are you, good morning, and things like that. And the goal of speech therapy is to provide communication effectiveness for as long as possible. And how can this be done? Using compensatory strategies like using an AAC device. So a little bit more on AAC. AAC stands for Augmentative Alternative Communication. It is a tool that is used to aid those who experience severe speech and language impairments. There are two types of AACs. There's low-tech AAC, which is a communication method that doesn't involve the use of an electronic device. And then you have high-tech AAC, which involves using an iPad or a tablet, which is an electronic device. And ALS patients are unable to meet their daily communication needs using natural speech. As I said previously, they will lose their ability to speak. So these AAC devices can really help those ALS patients communicate effectively. So going into more of the AAC high tech is most common for ALS patients because it includes things like eye tracking, speech generation devices, and speech to text, which can help these patients communicate. Eye tracking is a camera that's going to detect your eye movements and translate those movements into digital signals. And then these signals are going to control the electronic device that's going to produce the speech. This is a hands-free, independent means of communication as these ALS patients have a limited mobility. As I said previously, they lose the ability to have those voluntary movements like walking or running. As you can see on the picture on the right, this is an ALS patient that is using eye tracking. And then lastly, speech generating devices and speech to text are devices that allow a person to communicate through electronic voice generation. And this also can be used for voice and message banking. As I talked previously, the client will have the ability to use their previously recorded phrases or messages before they lost their ability to speak, and now they're able to use it with this communication device. And these are my references. Thank you for watching my presentation. I hope this gave you a better understanding about ALS patients, the impact on speech, and the role of a speech language pathologist for ALS patients.